everyone's time. Wow, that was quick. Thank you. I'm Ryan Hill. I'm the communications specialist for the Boise School District, and thank you for coming out tonight. We're obviously going to be covering some very weighty and heavy and important issues tonight, so I would ask that everyone remain respectful. One of my colleagues will be going over some norms that we'll be setting for the evening tonight, and I just appreciate you turning out and appreciating your taking this matter as seriously as we do. First up, I would like to introduce our superintendent, Kobe Dennis.
Well, good evening. I want to welcome all of you for the forum to the forum tonight. When I was asked to give the opening remarks for tonight's forum, I was struck by how to put my own feelings and emotions into words. Anguish, fear, and regret all came to my mind. But what seems to capture my feelings best are hurt and confusion. While we all could use different adjectives to describe our own unique feelings, I think we all can agree that we are all hurting as we try and process the most difficult of tragedies. And the pain that is suffered by families, loved ones, and our community. We have questions about why this happened. Is there someone else that needs our help? And how do we stop this from happening again? We all have a role to play in providing safety for our kids, both physically and emotionally. And that's what tonight is about, because there isn't anything more important. We have an esteemed panel of experts here to talk with all of you. But before I turn it over to them, I want to thank all of you for coming out on such short notice and acknowledge your commitment to help our young people. And with that, I'm going to turn it back over to Ryan Hill to kind of get us started. Thank you for coming.
Thanks, Kobe. Like I said, I'm going to turn it over to Jason Shanks, one of my colleagues, here in a second. We did hand out cards tonight. You should see them. If you have a question, when the panelists are finished with their individual presentation, we will be taking some selected audience questions, since we obviously won't be able to get to all of them tonight. But if you do have a question you would like to submit, please turn them in. We have runners available at the corners, and they will get them up to Anna from St. Luke's, and we will go through them and try to answer as many topics, if not individual questions, as we can. With that, I'd like to turn it over to Jason Shanks.
Okay, so we're going to see if this works, and we're already experiencing technical difficulties. So Anna, I may tap into you in a second. Of course, our clicker's not working now, but I just want to echo what Superintendent Dennis said. Thank you for being here. That one was dead. This one worked earlier, but so you may have to go with us. I think part of us being here tonight, too, is we just really need to acknowledge what's happening. And it's been a lot. If you're in the room right now, you're probably pretty affected by what's been happening. I'm affected. Our school district's affected. Community's affected. Families. I've walked into every school there's been a loss in. Those students really affected, the staff. So I think just honoring, like, we're trying to navigate this all together, and it's really going to take all of us coming together to figure out how to best support our community. This is happening with our youth, but it's happening broader scale as well. It's happening with our adults, and it's happening in our community. And we got to figure this out. So I'm so glad you're here. I'm so glad that we can talk about this as we continue to move forward to figure out what's best for all of us. The other thing I want to acknowledge as we're talking today, there may be a time when you're activated, and when I say activated, you may get mad, you may feel overwhelming grief, you may experience a lot of different things. If you do that, that's okay. I know that we've been feeling some of that too. Our goal here is not to upset anybody. Our goal is really to come together. How can we work together? If you do get activated, I have a plethora of social workers. Some are in the back. They're at a table out there. They are here specifically for that reason. If you need someone to talk to, they are there specifically for that. So I've already kind of said it. It does take a village. And it's been really amazing, all the people that have been reaching out of how can we help. Two of the best people that have reached out so far is the Speedy Foundation. I just want to thank them so much, and St. Luke's thanking them so much. They have worked together so much for this presentation, but also with anything else that we're needing with resources, they're partnering. But that is just a couple of them. We have had the VA reaching out. We've had BK, we've had so many different mental health agencies that wanted to be here tonight because they want to be able to support kids and families. So if you didn't get to linger out there a little bit, they will be here later today, and they can continue to answer questions. They can continue to provide resources. That's why we wanted them here. Some of them have openings and availability right now, and in the Valley, that's really hard to come by in some situations. So feel free to find them out there. We really want to start utilizing and continue to utilize it because we know we are way understaffed with mental health services in our community. A couple more things. One of the reasons we wanted to come in front of you sooner than later, and I know for some of you, you're going to say it wasn't soon enough. That's okay. We wanted to get here because we want to talk about suicide. And that word has been kind of a no-no word sometimes in our community, in our schools. If we talk about it, it's going to happen more. And that's not necessarily true. So we want to talk about it. We want to destigmatize talking about it. But we don't want to normalize suicide. It's still an atypical response to something that's going on. And there are things that we can do to help lower the numbers. So we want to talk about that today. Ryan talked about the cards. Please, as we're going, if you have a question, write your question on there. We will do our best to get that question answered. If it's not answered today, we are going to do our best to get back to you with an answer for that question after this as well. You'll also see we had probably about 50 questions that came in before, and we've tried to integrate some of that into what we are going to present on today. Originally, this wasn't going to be a Boise School District. We're talking about some of our stuff. But from the community, that's what we need to do a little bit. So we changed direction a little bit, and we are going to talk specifically about our students a little bit as well. We'll talk nationally about Idaho, and then very specifically about our students. And the last thing I really want to instill here is out of all of this, we've got to hold on to hope. And that may seem hard to do sometimes, especially right now when we are in the middle of a crisis. But if you can find hope in something, and for me it is our young people, I'm finding hope and I'm holding on to that, and I want to figure out how we can make sure that there are no more lives lost. And that might be a big ask right now, but that is my ask. We've got to support our community and our students and our families. How do we work together to make that happen? So for tonight, we want to talk about a few things. We want to talk about local and national suicide data, contagion, clusters. What does that look like in Boise right now? Some of the risk and protective factors, warning signs, and then suicide prevention, intervention, and postvention. And this is where we will dive in a little bit more into Boise specific. We will talk, what does it look like, and then how are we applying it? Because there's been lots of questions of what is happening, what does this look like, why don't you do this, why do you do this? So we'll talk about best practice with that as well. As we're going through any of that, like I said, fill out those question cards, we'll get them to Mr. Hill, and then we'll go into our moderated Q&A, and then we'll talk about what are our next steps, what's more to come, and where do we go from there.
And I do, just while they're forwarding that slide, I wanted to make sure that We did introduce the panel. Jason Shanks is the Supervisor of Counseling for the Boise School District. Dr. Gudmundsen is a child psychologist, and Shannon Decker is the Executive Director of the Speedy Foundation.
All right, so we just wanted to give a little bit of context, and I'll try and highlight when we're looking at national data versus Idaho data versus even more Treasure Valley or real local information. Also, I just want to comment that I'll try and be really specific about whether I'm talking about death by suicide versus suicidal thoughts or suicide attempts. And I think a little bit of exploration of that might give some relief in terms of it's a continuum. And just as we're kind of exploring this and talking about this, just want to underscore what Jason said is that it's absolutely protective to talk about suicide and not something that would cause it. And they've done studies about that and researched that pretty clearly. So looking a little bit, and suicide rate refers to death by suicide. And this kind of the take-home point is that Idaho is in the kind of that dark blue in terms of the suicide rate. And that Rocky Mountain West we're in kind of similar company there. And so again, often, particularly in the last few weeks, people, of course, wonder why that is and what some of those trends are, and we can start to talk about that in the context of kind of bigger picture risk factors and what leads to these rates, because that's true for both adults and youth. Oh, sure. Oh, hi, sorry, I'll be louder, or stuff yeah, they always say that. All right, can we go to the next slide, please? All right, so this is, again, going from the national data to Idaho data, and this is specifically for teens. So this is the CDC conducts every 2 years what's called the Youth Risk Behavior Survey, and this was the last time that Idaho participated. It is given to high school students, and this question in particular divides out by grades students who seriously considered suicide within the last year. So that, again, and they ask other questions, but it gets at a common phenomenon that you see across ages, starting in adolescence, which is that starting in adolescence, the suicidal ideation or thoughts about suicide start to increase, and we see a more prominent rate with girls. So they think more about suicide and have more even suicide attempts and self-harm thoughts. And then it is the case that males of all ages are more likely to die by suicide. So we're going to get into the numbers again. Big picture with youth is that this is a low base rate behavior. And of course, any one is too many, but this sort of gives a snapshot of specific data in our youth that we have. One thing that just to be aware of is our state has withdrawn from this survey, and so we won't have any more data from the survey unless we reconsider that. We do have some local investigators. Megan Smith specifically is doing some research to kind of address that gap, but it's really hard to change and intervene when you don't know what's happening. So we're bouncing around a little bit, so back to national data, but we're still looking at 12 to 17-year-olds. And this gets at that continuum of suicidality that I want to talk about. So it's a big number, so 3 million youth, when asked that question about the last year, about seriously considering suicide, that's a lot of individuals. And that's why we want people to be asking and talking and inquiring about how kids are doing, what they're thinking, what their friends are thinking, because that's a much easier place to intervene, to start to provide support, give help, not make sure it's not being a secret taboo thing. And then as you step down this list, you see kind of more serious signs of behavior, which is why if you've ever been witness to or conducted a risk assessment, these are the questions that they tend to get at because it imparts a level of risk. So it goes through a suicide plan, the number of youth who made a suicide attempt, and then the number who died by suicide within the previous year. So again, in I think sometimes people might be quick to jump to, oh, if someone's having a thought, they're gonna make an attempt. Unfortunately, there are lots of opportunities to intervene.
And Dr. Gudmundsen, before we go on, we just want to note, we've got 3 million who had seriously considered suicide, but we only lost 1,592. Those are individuals with families and dreams and hopes, but it's very rare. We have a huge amount of time and resources to intervene for people who are struggling. So there is hope. We want to just point that out, that is a much smaller number than where we start.
Absolutely. All right, so now what we're looking at are some data that Dr. Anna Radin she was able to quickly produce this from some of the work going on specifically with youth at St. Luke's. So this graph includes several years of screening data. So my guess is either at your own primary care visits or possibly your children's, you've begun to be asked some questions on an iPad or piece of paper about if you've, have you been wishing you were dead or not wanting to get up? Have you had actual thoughts about suicide? That type of thing. These are those data. And so we're taking a snapshot of any kid in our primary care and family medicine clinics who endorse some level of risk. So that would be any kind of signal on that. So anything but no on those questions. And the reason we just wanted to show this is just to give you a little bit of sense that there are some seasonal kind of ups and downs, peaks and valleys that tend to be pretty consistent over time. And these align with the national data and trends. So we all know that kids especially have rhythms in terms of more difficult times of year, and this slide indicates kind of dips in suicidal ideation. So again, we're looking at thoughts.
Could we get the next slide?
Next slide, sorry.
Oh, and it's kind of faint, but you can see that in Q3, and Q3, we've got a yellow highlight.
Yeah. It's not coming out, but those dips that you see are that July to September. So as protective as school can be, of course, that summer break, a lot of times people are doing a little bit better. There might be lower stress. The sun's out. There's all kinds of things that can just promote, maybe you just reduce risk in any given population. And then again, this is the third. Let's go to the next one. The riskier times is kind of the zone we're in now. So from October to March. I know my job involves working with a lot of high-risk adolescents, and we always have this August quiet, and then school starts, things start to get harder, and that dovetails with winter, potentially holidays, and any given individual situation is going to be different, but we do see sort of increased suicidal thoughts, increased endorsement of risk of suicide in the October to March months. And so these are just, again, some trends just to give you a snapshot of some very local data. So now we're going to shift to suicide clusters and contagion, and I'll hand it to Shannon.
Okay. All right, so a suicide cluster involves an excessive number of suicides, suicide attempts, or both that are occurring in a close space or time, or they involve social links between the cluster members. Suicide clusters are rare, and evidence documenting the implementation of suicide cluster response activities in communities remains limited. So what we know is that when it happens, there's not some package that we can just apply, that we need to really think about what's happening and how do we reach those who are struggling. There are two types of clusters. There's a point cluster, where there's a higher than expected number of suicides that happen within a time frame in a specific location, like a community or a school. So right now in the Boise area, we have experienced several suicides within close proximity, and those individuals were connected to each other, and so that would be a point cluster. A mass cluster is when there's a higher than expected number of suicides that happen within a period of time, but they're spread out geographically. So following the suicide death of Robin Williams, we saw huge spikes in suicides across the United States. That would be considered a mass cluster. And there was a lot of media attention on that suicide. There was a lot of inappropriate messaging, which really fed to people's feelings. People who were already predisposed to depression or suicidal ideation experienced that death and that loss differently. So, excuse me, it's been proposed that the suicide clusters are due to contagion, and that's the process where one person's suicide influences another to engage in suicidal behavior. So that example that I shared of Robin Williams passing, some people, even though they didn't know him, they were influenced by his death. Contagion may be particularly likely to occur in circumstances where the second person is already contemplating taking their own life, or they're particularly vulnerable or impressionable. The mechanisms by which contagion occurs are not fully understood, and they vary from person to person. Suicide is not contagious. We don't have an R0 in suicide. It's not contagious like Ebola or COVID-19, but the capacity to end one's life is what can be communicable. And we've got a YouTube keynote speaker by the name of David Covington, and he explains this capacity as courage. Courage is not the right word, but we don't have the right word in the English language. But it's this piece where if we think about courage, like that is communicable. You know, if I see somebody do something brave, I'm inspired to do something brave. So the opposite is true of something that's negative. If you are watching someone that you admire and you see that they're struggling and then they end their life, that is a negative impact. So courage is the wrong word, but if we think of that, we can kind of
Yeah. Do you mind? I might,
go for it.
One thing that brings up to mind, here, I'll eat the microphone. Thomas Joyner is really one of just a lead investigator scholar in terms of suicidality, and he has his theory of how someone comes to be suicidal has some echoes of that. So in his model, there's sort of a combination of factors, including perceived burdensomeness. That's very, perceived. So even if you assure someone they're not, but someone feeling like a burden, thwarted belongingness, so they're not feeling like they're belonging or have full acceptance in some sort of way. And then the other layer is that capacity, which might be another way to think about it, sort of a different conceptualization, but that can sometimes come through, it could come through media exposure, it could come through some sort of contagion effect, but it can also come through thinking about it, it can come through learning about it, potentially like engaging in self-harm or precursory behaviors. So that is a theory to explain how someone might become suicidal when you look at bigger data samples or bigger pools. And then any given individual situation, there are different ways it can happen. It's something that I know a lot of my colleagues and I talk a lot about, all being youth clinicians in different ways, that it's the impulsivity part is hard to predict or even hard to assess ahead of time, and that's a reality that is really challenging, especially with kids and adolescents. We'll get into all this, but so maybe thinking of that courage, bravery piece, there's also sort of, it might just be like this kind of capacity that can build over time to do that, and there are certainly some individuals that's just not in their capacity.
Yeah, the capacity building, exactly. Yep, there's a great Venn diagram if you want to do a Google image search of Thomas Joyner. and he's presenting in Provo on Monday and Tuesday if you'd like to catch him in person. So some of the possible links that researchers believe happen in these suicide clusters is they might have like an expression of grief or a means of escaping from pain after experiencing the suicide of another, particularly a friend or a relative. Or it could be an imitation. You've maybe heard the term copycat. So an imitation of another suicidal behavior as a way of dealing with a range of emotions or events that have taken place. They might have a desire to be recognized. This is why when we do lose a young person to suicide, we need to be really careful with how we message it and how we memorialize their death. We have to treat every single student death the same, but we need to be careful with what we do to, glorify the means of death. We don't want to be talking about the means in which they died. We don't want to be putting together memorials where it might be beneficial to some, but for others that are on the peripheral, if it's encouraging for them, that's what creates that contagion. And so we need to think about things in that like long-term way. If we lose a student in a car accident or to cancer, we want to be able to appreciate them, to grieve their loss, and we want to be able to treat their death the same way we would treat a suicide death. And so we just need to take those pieces into consideration. And then exposure to a particular method. So again, we don't want to be suggesting. I am with an organization that's very small. It's called the Speedy Foundation. It's a local nonprofit that was established in memory of my cousin. His nickname was Speedy. And when he passed in 2011 to suicide, his 911 call was released on TMZ to the media, and all of his teammates listened to it. Thankfully, somebody saw it and notified the family so that we could listen to it on our own terms without, just happening to hear it. But nobody needed to hear that type of pain, especially the people who loved him. In the headlines, in the newspaper articles was, Speedy died in this location with this means, and that was the headline. And so you didn't even have to read the article to find this really graphic information out. And those pieces created contagion within his peer group. He was 29 at the time, so we're not talking about youth suicide, but it still has this rippling effect to the people who knew him, the younger people that he coached, and so on. So those are some of the considerations, but again, this is really hard stuff to research, and we don't have a ton of solid evidence. We don't have a toolkit to just throw in place and be able to protect, everyone.
And so I want to mention too, one of the questions within the Google form today was why is the media not reporting on every one of these deaths? And that is exactly the reason why. If it's reported every time, then those more at-risk students could have a higher rate of also then wanting to complete or attempt suicide.
It tends to normalize it, they died, I feel bad, I guess that's my conclusion as well. And that's not at all the case. So let's talk a little bit about risk and protective factors. So these risk and protective factors are the same for adverse childhood experiences, things that happen during childhood in the home or in the environment, overdose, and suicide. So they all have these shared risk factors. At a societal level, having access to substances, easy access to lethal means, and by that we're talking about firearms, we're talking about medications or illicit drugs, we're talking about access to any other means that a young person might attempt to end their life. And then low access to care or services. And Jason's already mentioned that it can be really hard to get in to see clinicians, especially if it's a crisis. You can get into the emergency room, you can get into some critical care type of situations, but to find that long-term care can take time and patience and resources. So we acknowledge that Boise does have incredible services, but there's a really high demand, especially coming out of the pandemic. At a community level, low community connectedness is a huge risk factor. And what we're seeing in the Surgeon General's reports, what we're seeing in student surveys is that they do feel disconnected. A lot of the questions that were coming in for tonight and for the events that I've done in the past has been about cell phones and about technology. And this is the iPhone generation. They were all born after the iPhone was invented. They've grown up, with this computer in their pocket and access to communication 24/7, never being able to turn it off. And it's a big social experiment. What has that done to our ability to connect with each other? Relationships, we have bullying, financial stress, work stress in caregivers, social isolation, minimal support, trauma, abuse, and neglect. These risk factors are, on an individual level, and some of them are, what's perceived. Dr. Gudmundsen mentioned Joyner's theory on interpersonal suicidality, and when I look back at Speedy's life, he felt very isolated because of the struggles that he had gone through, and he also felt like a burden. That was a perceived burdensomeness. That was something that he internalized, and he was surrounded, even on the day that he died, he was surrounded by people who adored him. But it's what you feel on the inside. It's that connection. And so some of these pieces we won't know about unless we are asking someone, and we have built a relationship where they trust us and will communicate clearly. And then we have the individual level, the behavioral health, access to behavioral health, the physical health, and any type of special needs, poor coping skills, or trauma. Now, sometimes risk factors are overwhelming. It feels like we have no control over them. And so on the reverse are our protective factors. So this is what we do have control over, and this is what we can build and foster in a community, in a school, in a home, in a neighborhood, in a faith community, in a sports team. At a societal level, access to physical and mental health care, the availability of evidence-based treatments, the reduction of access to lethal means or doses. So out there at the resource tables, I promise you there are gun locks. I promise you there are pamphlets. We have a pamphlet on a safer home. We'll talk about access to lethal means in a little bit, but there's a lot that we can do to keep our families safe, to keep ourselves safe. At a community level, school connectedness is huge, and we'll talk about what the Boise School District is doing and what other programs are doing to really enforce genuine connection. At a relationship level, we know that one of the best protective factors for youth is a connection to a caring adult, at least one caring adult. 3 caring adults is ideal, and hopefully we've got young people who are connected to more than that. Now, adolescence and the teenage years can be really demanding, and so that one caring adult might not be the parent. It might not be somebody that's in the home. We know that relationships have ebbs and flows, and that there's conflict and there's turbulence sometimes. And so even if it's not you that's directly that trusted adult, we need to make sure that these young people have a trusted adult in their school, in their out-of-school life, and hopefully in their home. Positive friendships and peer networks is vital. We know that young people pay more attention. They value their peer relationships so much more than they do, or at least we all value our peer relationships. At an individual level, having conflict resolution, good coping skills, healthy relationship skills, and strong parenting skills if they're older, strong family relationship skills. These are all vital protective factors.
All right, so these are a few warning signs of suicide. I think that question has certainly come up a lot. Like, what do I need as a parent or an adult need to be paying attention to? First off, it's also, you want to be noticing a change, and so if you
so if some of these come up and that's sort of the baseline for your kid, that it's kind of the gestalt, the big picture. So I don't want these are the collection of them. So individuals who tend to have suicidal ideation and the continuum of suicidality will often talk about feeling like a burden, like Shannon was saying, in terms of it's that perceived burdensomeness. So again, even if I think sometimes it can be hard to fathom, like what? But if you get a sense that they feel that way, that's what's important, the perception. Not having a reason to live, feeling trapped, experiencing pain. So that could be physical pain or emotional or psychological pain. Expressing any sort of desire not to wake up, or certainly if they explicitly say wanting to kill themselves. I would note too that just to pay attention to if it's kind of a flippant comment or if it's humorous, or I so often hear people saying, oh, it's just to get attention. Well, give them attention. Like, that's okay. It's not to be, even if it really is a joke, you want to err on the side of asking, following up, just double checking, because hopefully you can both rest assured, like, no, I was just kidding, Mom, I promise. But in that moment, you even just open the door and say, I will talk to you about this stuff. You can talk to me about this. And to figure out a way to do it in a way that's just a natural part of your communication. Again, whether it's your own kid, your neighbor kid, just any young people or grown-up people in your life, for that matter. The behaviors you want to be paying attention to include a loss of interest in friends or family. So I think sometimes, especially with teens, we overly normalize the oh, they're just being a teenager, and we might ignore some of that adolescent withdrawal. Certainly can happen, but again, if that's not typical for your teen, you definitely want to pay attention. Or if there's not a natural reason, because they're grounded or they have to clean the room or what kind of but I think sometimes there's a risk in just overly normalizing. Oh, teens are going to be grumpy and they're going to withdraw. So just try and pay attention. But that loss of interest in friends or family, that sometimes you hear about anhedonia, that's an aspect of depression. So that loss of people or relationships or activities that they typically enjoy. So some of that is natural, but if it persists, that's something to pay attention to.
So they quit soccer, they drop off the soccer team, and they're not replacing that with, I don't know, doing a school musical, or they're not doing that to just go hang out with their friends all the time. They've just cut it out and they didn't replace it. That would be the warning sign.
Absolutely. Giving away like prized possessions or really important things in their life. If you do see an increase in high-risk behaviors, sort of this, like, it can be this more subtle act of self-harm, or like, I don't, that lack of wanting to survive, or just putting themselves in high-risk situations. I'm not sure. But like, even, again, sometimes I think substance use, alcohol use, experimentation can get overly normalized in adolescence. And not to say that it's not going to happen or that means a kid is suicidal, but that when someone is altered or high or drunk, that in that moment increases risk. And if you have a kid who's really doing a lot of that, or putting themselves at risk with substance or alcohol use, that's something to pay attention to. So again, increasing or starting. Sleep is really, if you notice big fluctuations in sleep, just insomnia is a risk factor. It's an individual risk factor. So prioritize sleep, and if you notice your child's having sleep problems, help get them into the doctor. Take away their screens at night. Google healthy sleep hygiene and stick to it if you can. Because that is a real gateway to depression and anxiety, and in turn, suicidality. So that's a really one that it's just going to support overall health. change in hygiene, or making explicit threats to harm oneself, or actually engaging in self-harm behavior. Finally, moods, depression, anxiety, irritability, rage, humiliation, and guilt. One thing too, though, I think depression is certainly something to be aware of, and actually a symptom of clinical depression is suicidal ideation, so they kind of overlap. But sometimes you hear the refrain, oh, but they weren't depressed, I don't get it. But so there are other mental health conditions, there are other situational conditions that can put someone at risk for suicide. So it's important to, and that's why it's important to ask, it's important to get really precise and don't use euphemisms, use the words to really understand what someone's going through, because sometimes there's a miss there. If you think, oh, they're not depressed or they don't seem depressed, there are other ways you can be at risk.
Thank you. To add on to that just a little bit, right now, if you've got a young person who's grieving a suicide loss or grieving anything, sleep is one thing to check in on. Make sure that your young person is getting good sleep. That's one thing, to just kind of keep an eye on right now. We talked about risk factors and then warning signs. And the difference is, if we think about heart attacks, I might be at risk of getting a heart attack. I might have a family history, I've got genetics that predispose me to a heart attack, but it doesn't mean that I'm going to have a heart attack. I'm not going to be concerned about my heart attack until I see those warning signs. So there's a lot of prevention that we can put in place when we know what those risk factors are, and then there's a lot of intervention when we start to see warning signs. So when we think about suicide prevention, we'll go to the next slide. We think about this cycle. We have a circle that's taking place. We've got prevention, intervention, post-intervention for a survivor of suicide attempts, and then we have postvention following a suicide loss. And that arrow right there is for a loss team, which is a specific model of supporting people. But we're going to talk about the supports that are in place in the Boise School District, as well as some other supports that are out there and could be adopted into the Boise area. But we think of this as a cycle. It's continuous, and some of the best suicide prevention out there is quality suicide postvention. What we're doing right now, coming together to grieve, to talk about it, to really look at best practices, and then to move forward, honoring the people that we've lost by preventing it from happening again. All right, so we've got this prevention model. If we can go to the next slide. So we want, like anything else in education, we've got different tiers. We want to make sure that we've got access to everything for all students. That's tier 1, universal. Like in math, everybody gets math curriculum for 9th grade. Some people are going to need a little bit of extra support, or they're going to need a little bit of challenge. So that would be tier 2. The same is true when it comes to mental health. And then for some individuals in their academics, they might need some really escalated pieces, a tier 3 piece, where not everybody needs it, but some do. And so like in gen ed, this would be like a special education piece. When we're talking about mental health, tier 1 would be mental health screenings, prevention messaging and family education, and then local mental health destigmatization. That's tier 1. Tier 2 would be site-based services like counseling, therapy, family involvements. This is targeted to some students who need it. And then tier 3 would be referrals to specialty care when we need to go outside of school services. There's also curriculum for schools that is tier 1 for everyone. Here in the Boise School District, in Boise, the Catholic schools have signs of suicide curriculum, which is given to everyone at the grade level. It's not given to just the people who are interested or just the people who are struggling. If we go to tier 2, there's a lot of sources of strength schools, and so those are supposed to be nominated by your peers to attend and to receive curriculum. So that would be those that are already the natural helpers. They're the eyes and the ears of the school. And so the programs that I run are called Hope Squads, and that's the same thing. It's a tier 2 level. And then tier 3 might be where we have those clinicians that are pushing into the schools.
All right, so as I'm reading the room, I've got to stand too, and if you need to readjust, that's fine too. The air is getting heavy, and that's okay. But we're going to talk a little bit about the Boise schools now and more specific things that are actually happening. And I really want to make sure that we are not taking this as we're trying to justify everything we're doing, but a lot of the questions we had were specific to this. So it's not necessarily we're trying to prove to you that we're doing everything. We're not. We need to do some things better. We're looking at it. We've been looking at it. We've been working through this even before these deaths started happening. It's meaning a lot more right now. So as we talk about prevention, many of you, I see some of the familiar faces in here. You were at the Communities for Youth event on Tuesday. There was over 300 people there talking about upstream prevention and how do we reach students about their mental health. And this is one of the best things that we can be doing right now, because several of the questions asked, is there a school counselor or a school mental health professional checking in with my student? And are they checking in with every single student in the school? And if you're at a Boise High with 1,500 students, that's a pretty big ask. They are seeing every student at some point, but it may not be a one-on-one sit-down check-in. That's not necessarily what a school counselor does in a high school. But what we do for screening and what we do to try to catch that and what we could do much more successfully last year was our mental health wellness survey. With our mental health wellness survey last year, we screened almost 8,000 students, and we were able to have a snapshot in what is that culture in that building, what's the culture in the district, and that gives a pretty good feeling of how things are doing. We had Communities for Youth meetings. We wanted parents to come engage with us, and we still continue to want to do that. Some of the information I have up here now, it's kind of hard to see, I'll talk through it a little bit, is direct information from our wellness survey from last year. Because our data this year, even though Boise Quad was one of the highest reporting opt-ins, thank you for opting in, the data still wasn't valid because we couldn't get enough people to opt in. So we don't have direct data to compare, which is really difficult now, especially as we're looking our first slide up here with our suicidal ideation with our students as of last year. This is very recent data, and we could have had more recent data. So as we're seeing this, we see that, and I want to make sure I say this right. So in the past 6 months, 71% of junior high and 66% of junior high did not have any suicidal ideation. But that means 29% and 34% did. My question is, going into this year with the losses that we've had then, is I really want to know where we're at, but we don't have that data. So I really encourage you as we move into next year, please opt in for the survey. That data is used. It's used for programming. There are specific meetings where school administration, school counselors, mental health professionals are looking at the data and seeing what does Boise High need? What does North Junior High need? Because the needs are different. There may be similarities, but they could be different too.
Could you just clarify, what is the name of this survey?
So this is the student wellness survey.
Student Wellness
Yep.
Survey. And then Gretchen had mentioned the Youth Risk Behavior Survey. So Idaho, Colorado, and Florida all pulled out of that national survey. And Colorado pulled out because they've already got a different survey that's much more, which is much larger. Florida and Idaho pulled out mainly for parent opt-in pieces and questions about sexual identity. So that's a piece that we won't have data for Idaho. We'll have national data, but it won't include Idaho or Florida. So if you want to take some action moving out of here, let's find out why we pulled out, and I would encourage you to advocate for Idaho to opt back in.
I would go one step further as well. With our legislatures, with the opt-in, oftentimes the hardest students to reach are the students that may not get that opt-in to actually come to us. So, and those may be the most at-risk students, not always, but that opt-in really, really hurts us. I think our numbers were in the 2,000s this year versus almost 8,000 last time. So through that data, that gave us really good information that we were working off of moving into this year. We've been thrown this very important curveball with all of the deaths that we had, but through that data, we saw that there was a higher risk for suicidal ideation. There was a fairly high anxiety and depression, 30-ish%, And when they broke that data down, because they can run all kinds of data models, they found 2 key factors that would have increased that, and it goes right back to what Dr. Gudmundsen and Shannon said earlier. Social isolation, not connecting, and stress. And if Dr. Smith was here, or Dr. Isabel as well, they would both say that's great, and you guys heard this at the Communities for Youth, because those are things that we can treat, because we know suicide is a symptom of other things going on. And these are things that we can directly treat. So if we go to the next slide, there was other really good things, and it tied directly into some of the questions that were asked. Lots of questions on the form were about cell phones and about social media, about usage, and that was one of the things that popped in the survey last year, is students were spending, 19% of our students were spending, what, is it 5 or more hours on social media a day? That's a ton. So how can we then as a school, which your questions were, how can we limit that? Are they doing it at school? Or how can we limit it once they're out of school? Do we have that cell phone locked up when it goes, when they go to the bed? Does the cell phone go with them in their room and then they're on their phone until 3 o'clock in the morning, then having another contributing factor of sleep? So just being able to have some of those discussions. Other things that reinforce what Shannon said as well, and we wanted to engage in this, and we continue to want to engage, is only 30% or 39% and 31% of our students said they could actually talk to their parents about something important. And that, as a parent, was really hard for me to digest. And that tells me as a school and as a community, how do we work through that, knowing that some of it's developmental. I would have never talked to my parents in my junior high or high school years, but making sure that they do have that one person they can talk to. Who is that trusted adult? Because we know that one safe person makes a difference. So for prevention for Boise schools, lots of questions on this. So we'll spend just a little bit of time here just so we can clear the air a little bit. And then if you have further questions, write them on that card. We want to make sure that we're supporting our students. We want to make sure that we're answering your questions the best that we can. So one of the most common questions was, when are my students learning about suicide? And it is in the curriculum in 8th and 11th grades. Interesting piece, 8th grade is a very opted out of, or health in 8th grade is very opted out of. So some students are not getting that. So then how do we catch those students and making sure that they're getting that information? Going back to what Shannon said, we have a little bit of work to do, and we've been working on it. How do we get information in every student's hands so they know if they're feeling a certain way, what they can do, and they know what if their friend is feeling a certain way, what they can do. Other things that we've been doing, elementaries, 3rd through 5th grade receive Sources of Strength, which is a suicide prevention curriculum that focuses on strengths. And I will tell you, as I was meeting with students at North Junior High, being able to ask the students, hey, did you go to elementary school in Boise schools? Yes. What are your strengths? And immediately the female I was meeting with, oh my gosh, my dad, my dog, I do this when I'm feeling down. And I said, hey, you know how to get through this then. This is really hard, but we've got to pull from those strengths right now. So that set a great groundwork for there. We are continuing to look at what's going to be working for us, though, in the junior high and the high schools. We need to look and see what is research-based, evidence-based, and so we're getting the best bang for our buck. So that's right in the middle of where we were at even before these things were happening. So I'm excited. Shannon's actually headed to Utah next week, and I have a plethora of counselors that are going to a prevention conference because they feel it's important too. So as we move through prevention, other things prevention too, we know that one trusted adult, we know talking to our students, we know getting them connected with something, whether it's sports, whatever we can connect them, whether it's through school, whether it's outside of school, we need to find their connection, find their people. So prevention, moving into intervention then, and Dr. Gudmundsen will talk a little bit about that more citywide or globally, and then we'll talk schools again.
Thank you. I won't belabor this, but this is just a snapshot, because sometimes these terms, they're meant to cycle into one another, but there is distinction. So again, I talked a little bit about how depression can lead to suicidality, as can anxiety, as can lots of different things. This slide includes evidence-based intervention for suicide. So this is something that that you want to ask for if your child is struggling with thoughts of suicide or any level of suicidality. We have individuals in our community that provide dialectical behavior therapy, which is meant to target that. There's different levels for adults, adolescents, and children. That's not all available in Boise, but we do have a number of adolescent programs. There are certain types of CBT that are suicide specific, and even if not, CBT is a real evidence-based mental health intervention. It's really hard to navigate mental health intervention if you can even just get with someone, and then to get with someone who can give you the therapy you want. Collaborative assessment and management of suicide, there's some people, myself, there are a few people trained where I think that's a big goal of our valley, to get more people trained with that. It's short and pretty easy to learn how to do. There's something called carrying context. Before we had any therapies with proof, and there was nice research showing that if you just kind of after an inpatient visit or an emergency room visit, if you send a postcard saying, hey, hope you're doing well, thinking about you, that reduced future suicide risk. So there's some more kind of modernized versions of that, and that's being studied and available in our community. But the other kinds of interventions, again, intervening with someone who's had some sort of level of risk or discussed that they may be having thoughts of suicide. You can do safety planning interventions, means restriction, crisis lines. I don't want to get too into it, but again, if you are someone who you're thinking, I need to maybe find my child or my niece or whomever some therapy, these are the types of things you want to be asking about and looking for if suicidality is one thing that's happening.
And I will just chime in here that when I work with people who just reach out and they're looking for resources, they don't know how to navigate crisis, if they are struggling with chronic suicidality, I will say, do you have a therapist? And either they do or they don't. And then the first line is, we need to get you connected to a therapist that you connect with. And let's try to find someone who has CAMS care. It can be really hard to find someone with this. When you go on to like Psychology Today or try to search for clinicians, they typically list out what their certifications are in. And CAMS is one that's hard to find. And so what I've started posing is, why don't you find the clinician that you click with and ask them if they will go get some professional development in CAMS. There's resources out there to help compensate for that. The state of Idaho needs to put some money together and make that happen. The Speedy Foundation brought CAMS training to Boise back in 2018. I know that the Zero Suicide Initiative with the state has also provided it, but it's pretty low cost. You can do it online on your own time. So if you're struggling, if your child is struggling, and you want someone to have some of these modalities, CAMS is a really good one that's going to treat the suicidality and focus just on the suicidality, and then it'll start to go into some of the other treatment modalities to address the underlying problems, because suicide is a symptom of additional things that are taking place.
So again, as we talk about intervention within the schools, probably several of you in here have had a phone call at some point. But we wanted to talk through that too, just given some of the questions. And I pulled the data this morning, and we've had roughly 230 suicide assessments completed in our district this year so far. And to me, I was like, oh, that's a lot. But then when I look, that is right on track for the past 5 years, almost to the number. So our school counselors, our mental health professionals, our social workers, they're working, and they're supporting students, and they are walking them through and trying to get them the best support they can. So what that looks like is you will always be communicated with if that is taking place, because that is our job. We screen, and then we report to parent, and the parent is always in charge of what's going to happen next. We may let you know, like, hey, I'm really worried about that, and here are some options, maybe hospitalization. We can look at getting you a counselor. We're going to do check-ins at the school. Whatever that level of care is, though, we want to make sure that student and the family feels supported. One thing I do want to say is school counselors do not do therapy, and I think that's a misconception. There was several questions in the forums too of why can't my kid get a one-on-one with a school counselor every week? School counselor is, what's my word? Brief, check-in. It could be several check-ins, but it is not therapy. Some of this may seem very basic, but I cannot tell you how many suicide assessments that I've done where I've called a family and then it didn't go quite the way I wanted it to. So I thought we'd just spend a second here as well. If you get that call, I hope you don't, but if you do, that is such an amazing time in a way because you finally have a direct access and you can be talking to your student about what's going on. If you get that call, please remain calm. Please be caring. I have had several situations that were not. Why would you say something like that? You know you have a good family. So not that rationalizing, bargaining with the student. Instead, what's going on? Tell me about this. What a great time to finally wrap your arms around, figuratively or literally, but being able to actually have a conversation with your student because, again, the other questions were, I don't know how to talk to my student about suicide. This is the perfect doorway sometimes. If you feel like you're unable to do it without that doorway, we're going to talk about tips to do it without the doorway, but this is a great doorway. With that safety plan going back then to removing the lethal means, locking up your guns, taking away those knives, oftentimes that student may have a plan that they've thought about and just eliminating whatever those means are.
Okay, so we've talked about prevention, we've talked about intervention, but postvention is this post-crisis intervention where support and assistance is provided for two groups, for those who have lost someone to suicide and for those who have experienced their own suicide attempt. And so the goal of postvention is to support the survivor bereavement experience, to support the healing and the recovery process after an attempt, to encourage safe and effective public messaging and media reporting of suicide, and to prevent further suicides and build hope for the future. And so, you know, I'm assuming you guys are here because you've been touched or you've been impacted or you've been just empowered. We need to wrap our arms around the community members who are bereaved. And you can do that in the tools that you have that you would support someone who's been bereaved in any other way. When we think about suicide death, we say that it's not a casserole disease. People don't line up to pack your freezer full of frozen lasagna. They might show up for the service and then it's back to the usual. Whereas when we lose someone to another means, oftentimes there's more follow-up. And so don't forget, it's really important to remember those that we've lost to suicide, to say their name out loud, to share memories of all the incredible things that they did and who they were. For those after a suicide attempt, it's important to continue to support them, and we could probably do a whole nother night on that piece. There's a lot of incredible resources out there, but I want to kind of just focus on postvention loss. I had the pleasure of working with Lee Flynn from the Idaho Suicide and Crisis Hotline. We put together some safe and effective public messaging training materials for Idaho's media, and we've done this several times now over the years and continue to just add more tools to the toolbox. But the Idaho media really has done a lot to make sure that they are messaging suicide loss. We do a lot of consultation. I know that St. Luke's and the school district and other Warm Springs Children's, they do a lot of media outreach, and they help those journalists, especially the younger journalists, really finesse the stories to make sure that they're appropriate and that they're safe. But there's a lot of guidelines. You can go to our website, you can just search online, but we've got a lot of those toolkits for messaging. I would say that things have changed rapidly when it comes to communications, and that our own personal social media and blogging can be something to take into consideration. Speedy died in 2011, and at that time, the media reported his death before the coroner came to the house to notify the family. And thankfully, there was a breakdown in the chain of command, and a police officer in Utah notified us, so we knew, but had that not happened, we would have found out from the news. And that was 2011. Messages happened so much faster. We know that, you know, in rural communities that I've responded to in a postvention response, sometimes people are finding out about this through text messages and through social media posts before they're officially notified. So we just need to be really cautious with that. And so if that's something that you're interested in, there are best practices. There's blogging and social media pieces. But we all, you know, have a role to play. It was already said, and there's a lot that we can do to help build hope for the future, that suicide death is preventable. When Dr. Gudmundsen was talking about warning signs and then the battery died, I neglected to say one other thing, and that is sometimes parents don't see those warning signs. That might not be something that you are picking up on, but your child's peers probably are. And that's why it's so important that the peers know what they're looking for. They know what the gut feeling is, that something's wrong, and that they are trained to go tell a trusted adult, that they don't keep that a secret, that they're not trying to problem solve for their friends. So having the conversation about your child's emotional health is important, but talking to them about their friends' emotional health is also really important.
Yeah, it could also be another avenue. Sometimes it's easier for kids and teens to talk about someone else too. So I think just be aware that often they are carrying the secrets or burdens or loads of friends, and they might not tell you that either, but it can also just, if you're kind of curious about, you know, that might just be another entree into their lives too. So they, I think we've made the point, but that's just, it's, again, as someone who almost every day I'm talking to teens who may be in struggling with this, they are often struggling with their friends' issues too, in terms of just the weight, the thoughts, and so even, and this is why even we'll talk a little bit about age-appropriate ways to talk about it. I just think the more you can just remind your kid even before it ever comes their way that sometimes being a good friend is to share stuff with other adults, and that they never need to be in that position.
I think we're probably all aware that we're in the postvention right now in our community. We're trying to get through. We're trying to figure out what's next. And as we are doing postvention, we're also looking ahead of prevention. We're looking at intervention. How can we do each of these better? So it's like Shannon said, it's a constant circle. One thing I think it's important to comment on too is we always want to respect the family and the wishes of the family. We are never going to report the cause of death if a family doesn't want to or want us to. We are always going to respect that, and I know that is really frustrating sometimes in the community that we cannot come out and directly say this was a suicide. In situations where we can say that, it is so much easier to have a conversation as a family, as a school, to be able to address it that way. And it really springboards us into having a better response. So in that postvention response, as probably many of you have seen or read the emails, like we are implementing our crisis response team that's going in. We are meeting with sometimes hundreds of students. And our main goal is really just to stabilize. They are in crisis, they are upset. We need to get those students either calm or we need to get them with their family, because their family can take care of them the best. So that is really, in the moment, what it is. As it moves down the road, it continues. I will tell you, one of the schools I was in is still in crisis right now. They're still constantly seeing students that are they're still in crisis from the events that have happened. So we are still there, and we continue to provide support, and when it gets so they may need outside referral, then we would pass them on too. So as we move forward, we're slowly going to back out of that, and the support will slowly be less. But if you have a student that is still in crisis or still hurting, let your school counselor know. There are grief groups being started. There are different psychoeducational groups that have started. Please let them know.
So just briefly, reminder, I think we've already talked about all these, but if this is a lot to take in, I would encourage you to take these 3 kind of to-dos away in terms of if you, to promote safety in your teens or your kids. So connect to and talk with your teens and their friends, support safe use of social media. That I just used a similar comparison yesterday. I always think of their social media as sort of like their room. Like can be times of privacy, but if you're worried about their social media or the kid themselves, go check it out. You can have them with you. Be like, hey, I'm worried about you. Something's going on, and we just need to. Your safety is right now making privacy something that you have less access to. Be thoughtful and careful about it. You don't want to necessarily push something, but social media, I think sometimes it's hard. You want them to have their own space, but you need to be, there's so much can happen on all the different modalities, so you need to figure out how to do that with them and or set limits for them when they really can't, and just educate yourselves on how to make sure that that's a safe thing. And then finally, learn about and implement lethal means safety measures. And really it's, buy yourself time and space, like whatever it is. Like I think sometimes people are like, well, you can't totally control it or manage it, but instead of arguing about that, just make sure that it's not easily accessible. So for example, whether that's firearms or something else, just that can be helpful. And it's often temporary. So in the short term, it might be cumbersome to potentially reduce access to potential means of harm, and it might save their lives. So if you're at all unsure, think about how in your home or any home they're in. So if you have 2 households, think about both households, grandma's house, best friend's house. Just be aware of the spaces that your kid is in. This is just a little, again, I'm recognizing that often a lot of us have kids of lots of different ages, so wanting to give a little bit of thought about developmental stage. So when you're thinking about talking about suicide, if you have younger kids, preschoolers are still trying to figure out that death is permanent. It's highly unlikely you would talk about it, but if you lose a family member, there's a situation where someone died, I think it's important to be as real and clear as possible so that they don't get confused. Their body stopped working, that kind of thing. Then as you move into grade school, they're starting to mature, starting to have the cognitive ability to understand that death is permanent. And depending on the situation, and particularly if there's a direct question from you or the loss of someone where it would be important to talk about this, but often again it's kind of being thrown at you unexpectedly, potentially from something they heard about or learned about. But you can talk about suicide being due to an illness, a brain sickness, and just say, it's okay to be sad and about losing this person or that this happened. As always, when you're always kind of balancing losses, no matter the loss, you want to share all the memories of the person's life and really focus on the life and that person. And that's true for talking about it with kids too. But again, you're always wanting to set the stage for opening the door for questions and conversations. It's not taboo. It's not something you can't talk about. As they move into more preteen stages, they're going to start to know the word suicide. And I think, like so many things, you want them to potentially talk to you or another adult about this rather than getting their first introduction to this topic from friends or Snapchat or what have you. So if again, if your preteen is asking you directly about it, you might just be curious, like, so what do you know? Do you know what that means? Like, find out what they know already to try and, kind of gauge the level of the conversation. These conversations ideally are short. You're answering their questions, but you're just creating the back and forth that for those kind of younger kids. And again, always saying that, yeah, mental health struggles can make it hard, and we can treat them. We can prevent them. Then as you move into teen, again, by the time 13, 14 is when the risk is present. So it really would be important to have had some discussion and education about suicide. Be curious, be direct, whether it's someone talking about maybe, Robin Williams or a famous person, or if they're worried about a friend, but use the word suicide. If that's hard, practice with your partner or in the mirror. These direct conversations are important. Listen to your kid, listen to what they have to say. If they're talking about their own thoughts, just try and understand it and make sure they're able to talk about it. If you hear a radio story or something about a loss in the media, use that as an opportunity to ask about it. If your team seems sad, ask about it. So again, you just want to, throughout their lives, be creating space that you can handle hard conversations, you're going to be honest, and if they're getting too much into it early on, you can set a healthy limit and figure out a way to talk about it. But it's just something that like so many hot topics, whether it's sex, drugs, rock and roll, this is something that needs to be developmentally a part of conversations throughout their life.
And talking about it directly is really important. If we're 12 years and older, and sometimes younger than that, like, we need to say, are you having thoughts of suicide? Are you thinking about killing yourself? Sometimes it's an uncomfortable thing. We've kind of been conditioned that it's not appropriate to talk about, and that we talk in euphemisms. But we have to talk directly about this because we're talking about pain. And so for a parent to say, are you thinking about hurting yourself? A young person might come back and say, no, I'm not. Because what they're thinking about is ending their life. They're ending their pain. And it's not going to hurt from their perspective. So we want to talk about suicide directly. We want to be able to say the word. You might have to practice with someone else. Taking a gatekeeper training here in the future would be really beneficial. I also want to encourage you to call the hotline. You can call 988 and you can say, listen, I'm not in crisis, but I do have some questions. I need some help in having this conversation. And if they're not busy, they can absolutely talk you through that. It's a non-judgmental, listening, confidential ear. So I encourage you to reach out to them as a resource to have some of these planning discussions.
Just want to briefly go over, already talked a little bit about social media safety, but we're going to provide resources, but this is a really excellent one that's specifically for teens and for parents about social media and suicide. So these are just some things to think about. And again, being responsible. There's always that tightrope of you want to talk about suicide, not use euphemisms, and not to glorify it in any sort of way. Or potentially activating people in a space that they just want to see a cat meme or something. So before you post anything online about suicide, be really thoughtful, be really careful about it. We'll get into some language considerations on the next slide, but you want to, I think, be careful about sharing your thoughts about, like, if you're struggling with suicidal thoughts, I would not do that online. Again, it's sort of this very specific kind of wound, pain, or place with people that you don't want to activate it in a way that could be detrimental for anyone. You can read through these. The final one with memorial websites, pages, and closed groups, that's, again, you just want to be thoughtful. So instead of having smaller groups of people who know each other and can talk about and remember people is really helpful. You want to memorialize in the same way any loss that would happen, but we're all really just impressionable creatures, so we don't want to have any little part of someone being like, oh, like that's somehow going to make me special take what feels maybe like a really painful part of their life and put a spin on it that is more positive in a way that's not responsible. So I don't want to legislate people's language, but I think sometimes some of this, we get all these linguistic habits. So things like, for example, you hear commit suicide a lot. I don't think there's malintention with that.
Next slide.
Sorry, next slide. Keep doing that. But so that can be, that sort of can connote criminality or even success or failure. These are just, again, and I really think people aren't meaning to, but sometimes that language is important. So maybe start to think about how you're talking about suicide. So someone dies by suicide. And then saying suicide is a solution to a problem, or like saying, oh, they killed themselves this way. I think, again, in the same way that we want to honor people's privacy, their feelings. It's often very complex, and it may be in the context of feeling like a suicidal person might feel, oh, this is going to end my pain, and you kind of can get into a tunnel vision where that's the only option you can think of. But again, I think we don't want to put sort of a positive frame on it. So these are just some things to think about, whether it's verbally or social media.
Yes. And a lot of the questions that were coming in about social media and technology are things for us to really take into consideration, but that's more of an upstream prevention conversation, and something that, coming to forums and talking about that's really important. We have some tip sheets at the Speedy Foundation table. We've been working with the Resilience Project and the Children's Home Society over the last year, screening some films. And one film is called Like, which is all about social media hygiene. And then there's another film called The Upstanders, which is about bullying and cyberbullying and learning how to be an upstander. Then there's one more film called Angst, which is all about youth anxiety. And so there's tip sheets. These films are available to screen at no cost until December 31st. So these would be some powerful films to watch with your young people, to have conversations. There's all kinds of tools that are available. But a lot of the questions that I saw coming in were around the phones, having access to phones at school, having access to social media. That's another huge forum to have and to figure out some solutions. So I just want to chime that in with the social media piece. But talking about lethal means, we want to talk about having safer homes. So this is a home that practices harm reduction. So in this home, we have smoke detectors, and most homes should have smoke detectors. That is to reduce harm in case there is a fire. Maybe they practice safe sex and they have condoms. Maybe they have a bike helmet to protect in case they have a bike accident, or they have a shade hat to protect from the sun. Maybe they have Narcan in their first aid kit to help in case there's an opioid overdose. They might also keep 911 and 988 programmed into their phones. We teach young children, how to call 911 in case of an emergency. We teach them their phone number and their address. This is all for safety. We need to start thinking about emotional safety and recognizing that at a certain point, our young people need to know what 988 is, and that if they're ever feeling like they don't have someone that they can talk to in real life, that they can call 988. We might want to be looking at safety planning tools, which is a great intervention, as an upstream prevention piece, where we go, do our young people know, who their trusted adults are, who their professionals are, if they feel like they need to talk to a professional? Do they know their reasons for living? What brings them joy and really anchors them to life? That is one way that we can use a safety plan, an intervention tool, upstream from crisis. We want to make sure that our firearms are locked, that we limit access in times of crisis, and that we remove them from the home until things improve. And so one additional piece that you might consider is to put photos of those reasons for living. Maybe it's your pet, maybe it's a family photo, maybe it's a special place. Put some photos near the family safe if you have guns in the home. But these are all methods of just reducing harm.
Also, if you have a code, change it frequently kids so often know those codes to get into safes or different places, so just don't underestimate your kids. They know how to get into stuff.
Yes, and I forgot to mention, a lot of us go to Costco when we buy massive quantities of things, but if you're buying massive quantities of painkillers, make sure they're in blister packs, because that's putting time and distance between someone. They really have to sit there and pop a lot of pills out if that's the means that they're going to attempt with.
So yeah, I really appreciate that. I love that safer home visual and just all the different ways to reduce access to potential means of harm. And one thing, I think it's important to understand this slide because there's just no way around it. This access to firearms is a risk factor to suicide. And firearms and youth suicide usually belong to a parent. Reducing access to lethal means saves lives. This was a real kind of hit. It might have even hit your news feed a few years ago, but you can see this blue line is the kind of long-standing leading cause of death of children, so age 0 to 19, until you can see where the green line crosses the blue line. That happened in 2020, and people were really alarmed, and so that's firearm death. So that's suicide or homicide or accidental death, but that eclipsed motor vehicle accidents, which we should reduce those too, but it's much easier as an individual person in your household to reduce access to firearms or to separate ammunition and firearms and things like that, which is why it is such a common recommendation to maintain safety, is because it just, even if you look at youth compared to adults, it's around 80% of people who die by suicide in our state, or it's due to firearms. So that's really the, if you feel overwhelmed, that's sort of your first, I would say, your first go-to if you have any concerns about risk.
I know we are getting short on time, so I want us to wrap it up a little bit and get to actually the questions that you guys had. So I see that Ryan has popped up here, and we'll give you a microphone, Ryan, and then we will kind of wrap this up.
Great, thank you so much, and what an excellent panel and presentation. We do have a number of questions from the audience. I do want to make sure that if you submitted a question and it wasn't answered, it may have had something to do with a very specific or a very personal encounter, or if there's a question that you have about specific school district policies or practices, please reach out to your principal or to one of us at the district offices, and we'll answer those questions offline. But the first question, and you've covered this a little bit, but I think it's worth repeating. What role do smartphones and social media play in mental health and suicide with our kids?
All right, so it's an emerging field. We know that they are connected. We know that it's the wild, wild west, and that people will do and say whatever they want online, and that there's very little accountability, and that our children, this generation, is the experiment. It's having a huge impact on our mental health, and what we see in surveys, what we see in research, is that there's a direct connection, and that the more that we are connected through technology, the less we're connected in real life. What I really like about the film that I recommend you guys take a watch, is that it's not doom and gloom. I know some of you guys have seen Screenagers, and that feels really doom and gloom to me. But is a little bit more realistic. We've created this online universe, and it's here to stay, and we need to figure out, how do we create good technological hygiene? How do we protect ourselves on social media? So it's a big question, and they are directly connected. I would also say that we've said that we need to really focus on hope, and one acronym of HOPE is healthy outcomes from positive experiences. We can have healthy experiences online, but we need to really be fostering real, in-person, live, face-to-face interactions. We need to really be focusing on social skills and healthy outcomes from positive experiences. Even if we're grieving, even if we're crying, if we can do that together, if we can support each other, and if we can have, the chemicals that happen when we touch each other and when we make eye contact, that builds hope.
Yeah, I guess I would just add, I think there was a little, just to add on, early on there was sort of some question like, is it affecting our mental health negatively? And the jury's in, it is. So there are increased rates of depression, anxiety, suicidality in youth and adults after engaging in social media use. And that isn't to demonize it. I think there's very healthy ways. There are certain really protective things for particularly if maybe you live in, you're the only gay kid in your school that you know of. You can forge a healthy community with people all over the country, all over the world, as one example. So again, I think this is where you like cozy up with your kid and see what they're doing, see what sites they're on, what are they doing, time limit it, figure out, oh, if I'm on it for 10 minutes versus 3 hours, I feel a lot better. So there's a Common Sense Media is a great website. The American Academy of Pediatrics has a family media plan, and you can put your age group, and then you fill in all the things they want to do, because that's what the problem is screens and technology aren't necessarily bad, but what are all the things you're not doing? You're not going outside, you're not seeing friends in person, you're not sitting at the dinner table with your family. But it's a way to be more proactive and focus on what do you want your kids to be doing, given that we know that if there's an overemphasis on screens, that's detrimental. And again, if that's no longer a question mark, we have really good data to support that.
I see a few of you with cards in your hand. If you have a card, you can put it in there, and there will be runners that come grab them from you.
Great, thank you. Thanks, Jason. And this one these two are probably more for you, Jason, but certainly anybody feel to contribute to it. One, how can we destigmatize seeing the school counselor, and if such a stigma exists? And what can parents do for students to confidentially report concerns about another student or a family member that's at risk for suicide?
So I think, one, everybody's personalities are different, and school counselors, just like regular counselors, are like shoes. Sometimes you have one that fits you, and it's great. Sometimes you don't, and sometimes you can just tell that by looking at them. So destigmatizing it, though, I think the more we talk about it, and we've came a long ways in the 10 years that I've been a school counselor, talking about it, breaking down that barrier. Sometimes parents have to actually initiate that for the school counselor. Sometimes it's just the culture in the building. We've got to work through some of that. So I don't think I think that's a complex question that doesn't have a simple answer. Every scenario would be different. Ryan, what was the second question?
The second question is that if you have concerns about another student, how can you report that confidentiality? How can you report that in a confidential manner?
So I think there's a few ways with that as well. We've had students drop notes off to a school counselor that just give details. That's a confidential way you could report it and say you want to remain confidential, and typically that will be honored. An email, there's several ways.
There's another really cool resource, and I really hope I'm going to get this right, so someone yell out if I get it wrong. It's called CTalk Now. It's a local, Chris, somebody who's really wonderful, created this anonymous reporting tool, and it's could be related to suicide, it could be related to violence, it could be related to anything, but it's free to all Idaho schools, but it's a sort of, he's a formerly involved with law enforcement, but it's this way to just harness and capture any sort of anonymous reporting, and he has it, I'm not giving it its due, but set up so that then schools can act on this type of information.
Yes, so most states have an app, an anonymous reporting app, and this one is one that I've reached out to try to understand what their training is, what their background is in being able to assess for suicidality, or if it's just a law enforcement response. I've not been able to get to the bottom of it, and so it would be really good for somebody to kind of just make sure that they are trauma-informed and that they are capable of supporting suicidal, and it doesn't just go to a law enforcement response. But I would encourage that we start to get to the point where we don't have to be so concerned about secrecy. That as students, that when they're concerned about a friend with an eating disorder or with a drinking problem, that they feel passionate enough to go to the counselor, go to another trusted adult, go to their friends' parents, and say something. I think that they do for some things, like alcohol. I think that they do for eating disorders. I don't think the same is true for suicidality. And the way that we change that culture to give them permission to be able to do that is to start talking about it, is to give gatekeeper training so that they know that there doesn't have to be that shame and that stigma, and that it's okay to lose a friendship over it, that saving a life is worth taking that risk. So there are methods to do things confidentially, but we need to get to the point where we can talk about things directly. In 2018, KTVB asked me to come in and do a segment on the news for a Olympic thing in Speedy's memory. And so I got in and I said, I'm going to talk about QPR training. I'm going to encourage everyone to take suicide prevention training. And they were like, no, you're not going to say the word suicide. And that was 2018. So we've come a long way in changing the culture and our ability to talk about this problem directly, but there's still a long way to go.
Okay, thank you very much. And also, just as a reminder, this session tonight is being recorded. It will be available on the district's YouTube channel. I don't know if any of our other partners will share it at this point, but we'll certainly make it available as soon as we can get it uploaded. Also, I'll talk to the panel after this, but I hope that we'll be able to make the slide deck available as well to anybody who's interested. Two questions that are somewhat related. One, what if your at-risk kid doesn't like to talk? Or maybe even not your at-risk kid doesn't like to talk. What can a parent do when their teen is depressed but they refuse counseling or medication?
Jing, is it on? Okay. So I guess I would, as someone who's all about kind of counseling and mental health, I think there's other ways to get your child engaged, and it doesn't have to be therapy. It can be that if that's a non-starter, you might figure out a different way. Are they able to talk to a coach? Are they able to talk to their pediatrician, their teacher? I think you can take that avenue. If they're not talking, would they write? Would they text you? Would they go to therapy with a friend? Just really try to get creative. Another thing is to take a middle path. So be like, hey, can we try this for a month? Can we do it one time? You don't have to have it be perfect, but just take it kind of one day at a time. Find out if there's another kid, ideally someone maybe, whether it's an older cousin or sibling or someone who would be willing to share their personal experience that was positive. You can also try you can try books. There are different, if you go through, I share different resources online. But nowadays, I think you want to try and figure out something they are willing to do and then expand that to make sure there's a safe adult, or over time, just figure out how might we at least try this, because it's common that it isn't so bad. And some people aren't, that's not the modality that they're gonna do. But for depression specifically, exercise is an antidepressant. Social connection, spending time with people has this antidepressant. And I say that in terms of even the neurotransmitter effects, the symptoms. So it's not just like a catchword. So I think you need to get sort of creative, figure out with anyone else in that person's life how they might engage in things that are sort of going to be incompatible with depression. And it might have to start small, or you might have to negotiate in some way, but keep trying it and keep revisiting it, or figure out someone who can partner with you to make it happen.
Great, thank you. Did you want to add?
I was just going to add modeling. Are you going to professional therapy? Have you shown that when you're struggling that this is how you seek help? And do they have role models, anybody that they look up to who can also model that type of behavior? And if you've ever taken like a mental health first aid class, they've got the algae action plan. And there's 2 E's. One is encourage appropriate professional help, and one is encourage self-help and other support strategies. And those 2 go hand in hand. That self-help and those activities, exercise, whatever it is that they're interested in, and encouraging those is just as important as the professional help almost all the time.
And then a couple of questions related to what role does religion, churches, or the faith-based community play in this solution? And I think, too, what we could maybe do is expand that to not just the faith-based community, but what do you see as maybe the non-clinical relationships that are out there that we can be building throughout the community?
I think in one aspect, we've talked a lot about social isolation and connection, and if a student's going to church, if they're found a church group and they're connected, that is a risk protective factor. So if the church is going to be involved in mental health stuff, great. I would just hope that it's partially research-based and clinically relevant to what they're doing, and they have someone that's trained doing it. But more importantly, I think it comes back, for me, for that connection piece.
The only thing I'd add is I think, there maybe historically has been this big divide between kind of faith and spirituality and therapy. I think increasing there's this recognition of how you need the whole person. So you want to just grow and expand anything that's healthy. I think, that sort of the traditional mental health forms that you fill out include a whole section on that because you want to boost any existing protective factors. But it does go back to just knowing your kid, knowing that community, and then I think the other thing you want to just think about is depending on how your family has operationalized that, I would, some families allow as kids develop and mature, like decide, do I want to be a part of that community or not? So if you are getting really severe pushback for some reason, explore it, figure out how to kind of explore values. I would, any time, whether it's about religion or really nearly any topic, you want to, if you find yourself getting into a power struggle or taking a really reactive stance, maybe take a minute and try and at least understand, hear them out where they're coming from about why they may not want to go to church or whether that's changed, or because I think that's where I've seen sometimes some issues is that they get to this impasse and then they're not talking about it and it becomes like a punishment or something like that. But largely it's just this wealth of support and protection and connection.
Yeah, when it comes to faith communities, it's belongingness, that a person needs to feel like they belong there, and if they feel like they are not truly a member of their community, if they're not appreciated for who they are, then that's when it's not a protective factor. It's the same thing in a sports league where, sports can be really difficult and coaches can be really hard, but the person needs to feel like they belong, that they're valued and that they're worthy. And if it's not, if that culture is bad, then that becomes a risk factor. So any out of school activities, anything out of the home, it's belongingness that's really key.
Okay, and this is more of a technical question, but I think it's important because there's a lot of language that's been used tonight that sometimes there's some barriers with it. One, can you please talk more about the difference between destigmatization and normalizing? And then I personally would like to know what gatekeepers are.
Okay, so a gatekeeper, love it or hate the term, it is what they call a suicide prevention training. And it's really just knowing what the signs are. I mean, we've kind of done a gatekeeper training here tonight, but it's knowing the signs, being able to ask the question when you get an alarm going off in your body that something isn't right. You see that there's smoke happening and you're like, I need to ask this person the question. Knowing how to ask the question, asking the question directly, persuading that person that there's hope and help available, and then referring them to that help. There's all kinds of gatekeeper trainings. I just used language from QPR, but there's tons. There's Safe Talk is an amazing one that the hotline provides a lot. There's a lot of organizations. NAMI is another one that provides Safe Talk. I run one called Know the Signs with some of the schools that I work with. There's folks in the hospital that have one called Know the 5 Signs. So there's a lot of different gatekeeper trainings that are out there. Normalizing versus destigmatizing. Where is the line there? That's a really good question. We want to destigmatize things where there's not such shock and awe, and we want to take it to the point where it's not just normalizing it and making it so that it feels like this is just a forever thing. So I feel like tonight we destigmatized suicide contagion in clusters. We didn't normalize it. We are saying that this is a very rare phenomenon. It's something that we have the capacity to come together and to grieve and to work to build structure to prevent in the future, but that this isn't normal and that we're not going to have, this same meeting again next year, and we're not on the trajectory that this is our new normal. So I think that's, for me, the difference between norm and destigmatizing.
Great. And we did have a couple of questions related to some very specific things that are going on in our schools post-suicide, particularly Boise and North. If you have questions about that, I would encourage you either one to talk to somebody after we wrap this up or contact us as well. This one is, I think this is a really good question. What can we do to increase teen coping skills after a breakup? And how can we help someone that feels like they're a burden know that they're not?
I think my first thought, and you might have to remind me of the second one, but I'm thinking of like the teen coping after breakup. That is an example of where it can be tempting to just minimize that and say, oh, you'll be fine, there's lots of efficiency, what have you. It's, whether it's a breakup or the loss of a pet or certain new territory or new losses, relationship ruptures, take it seriously. You don't want to have it last forever, but I would validate that it's really hard and sad, be curious about it. So let them have those feelings and not feel ashamed or embarrassed or minimized. I think it's all too easy to just, often that might be something we've had experience with in junior high or high school, and we got through it and it's fine. But that's, if you just sort of think about when people say, oh, you'll be fine, or that's really invalidating and minimizing, and it doesn't, so let them feel their feelings and then figure out how to learn from whatever that situation was and reinvest that emotional energy in other relationships. But again, make sure that they're talking about it, because again, part of the tricky thing with this age group is their, limbic brain amygdala is powerful, and their kind of like ability to balance short and long term, or like recognize that emotions are temporary, is really impaired. I think the second thing was, how do you make sure people know that they are loved and that they belong? I think you do that through your time, your words, again, and it might be playing that video game with them that you hate, or watching, engaging with them, learning all about it. Time is really invaluable, and just saying it over and over again. And you can be that annoying parent or aunt or friend who is maybe cheesy and says really vulnerable or emotional things, but those sink in. I mean, but you want to have both the actions and the sentiment, and have it be really authentic would be kind of what comes to mind.
I would just say, as parents, watch the advice. Like, if a child is struggling, sometimes you want to give advice, you've been there before, you want to just share that. Instead, listen, sit in silence. You can offer, I've been through something similar. Would you like to hear what it was like when I went through something when I was your age? And give them the choice, because they probably don't want to hear about it. But they might come back and say, I know that you went through this. What was it like? How did you get through it, right? Give them that choice. It's kind of like, I used to teach kindergarten, and I'd say, we're going to write our names. Do you want to use the blue crayon or the red crayon? Like, those are your two choices. You get a lot of autonomy. Which one do you want? I'm still controlling it. It's giving that young person some autonomy, and they don't have to listen to your life experiences, but they know that you care and that you've been through something similar, and when they want to hear about it, they'll come back to you for that.
And I want to rewind even a little bit to set our teens up to be able to get through hard things like that, because breakups are hard. I could look around right now and think of, as we're thinking about each of our first breakups, they're really hard. But as an elementary person too, let your kids do hard things and let them fail. Because when they fail and they can feel that and then they can do the little things and get through it, it slowly builds them up and builds that resiliency within them. And then when the harder things come, they have something to fall back on. That's not going to fix something right now for a teenager if they haven't had that. But for our littles, if we have any parents in here with that, that is something really hard to do, but it's something that is really great in the long run to be able to do.
Great, thank you. And we had a couple of questions regarding what people can do to activate maybe some changes at the state level. This tonight probably isn't that panel for that, but I would certainly echo what both Jason and I think Shannon called for, was that if this is important to you, certainly talk to your local representatives, your state representatives, about the importance of mental health and support for mental health across the state. One other thing that I will leave you with is if there are some closing remarks each of you would like to make tonight, we would certainly appreciate it.
I think for me, I'm coming full circle back to, I have a lot of hope for our community. I have hope for our families, for our students. And I'm just hopeful that we can continue to come together to support these young people and to support each other. That's really important for me.
Yeah, I think my kind of parting words are just to just connect with all, not only your youth, but with each other. Take care of yourself too. This is really hard. I think so many of us have been hit personally, professionally, you learn on the soccer field or your kid's preschool. Like, it's hitting in all directions. And so just take care of yourself, connect with people. If you're thinking of someone, text them. So just certain days it's gonna look differently, but do what you can to feed yourself, feed the people around you, and connect. And there might be some days where you're in bed watching The Crown or whatever it is, but just know what you need to keep going and try again the next day, because it really, I think, our schools have just been heroic. I feel like our whole community is stepping up, and it really does. I think there was a time where we used to want to just, can you go talk to the social worker, or kind of silo it. It really is all of us, and this is amazing to have this presence here tonight. So just keep showing up as a whole community now when your kids are grown, or in whatever way that you are a part of this really beautiful community.
I'm really honored to be here tonight. I'm really just empowered to see everyone here. I know that we're here out of really tragic circumstances, and that I've been empowered to be involved in suicide prevention since 2011, and that it's kind of been an isolated and lonely place. It's hard to gain attention and support and funding, and that sometimes it takes these really difficult tragedies to be able to come in and really build in robust supports for intervention and for prevention. And so don't lose momentum. Don't let these losses be in vain. It's time to take action. And you guys have a lot of power. You've got a great support in the school district. The city of Boise is at the table. The state of Idaho needs a lot of help. And if you are interested in doing things at the state level, I can point you in some directions. But if we skip to the next slide, I think that leads us into the pieces of taking action. I will let others talk
So as we continue to move forward, Communities for Youth in City of Boise continues to have a call for action. Be looking for those types of things. You can partner with the city. You can continue to have a voice. Also, the Student Wellbeing Survey, if you want to know that, that is available at your school. If you want to have a night where you want to talk about that and have Communities for Youth there to kind of dissect the information with you, that is something that we would offer at different schools. So let your principal know that.
All right. Education is my passion, and so the Speedy Foundation has an amazing partnership with the Children's Home Society of Idaho. We have been doing these film screenings over the past year. That is one piece of action that you guys can walk away and do from your homes. The Speedy Foundation has been running a postvention training, and that will go live online tomorrow. We're also offering a educator professional development that'll take place on the 7th, the 14th, and the 21st. It's a 15-hour credit that's being sponsored by Optum Idaho and the Idaho Case Management. We'll be meeting with we'll be doing some self-study. We'll be meeting with some experts, Dr. Jonathan Singer, Dr. Julie Cyril, and then the director of these films. We'll be working with the Children's Home to develop some clinical postvention professional development based off of the best practices that are out there. The Children's Home is also working to develop youth survivor of loss and youth attempt survivor groups. We will be co-developing a teen mental health literacy training based off of a curriculum that the state of Washington and the health systems up in Canada have put together. And then based off of some of the feedback I've received in the past couple days, it sounds like we want some parent coaching. And so we'll put together a parent coaching webinar on how to have these conversations. It can be really difficult to have conversations with your kids that are grieving or who are struggling with their own suicidality. I've also gotten the request for some neurodivergent conversations, how to have mental health conversations with the neurodivergent young people. And so we'll put together some parent coaching webinars.
And I think the last thing, just as we move forward, if you want to know some more of the answers to these questions, the social workers out in the lobby, they have a table. Make sure to give them your email address. That won't be for spam or anything. It will literally just be to have a more robust answer to some of those questions.
Great. Well, thank you very much for coming tonight. As a reminder, this was recorded and will be available on the district's YouTube channel in the next couple of days.